what we're looking at here, Greg?
Well, as you can see on the one model, you have the normal knee joint, which there's good spacing within the joint. Over on the other side, where the arthritis is present, you can even see some breakdown of the bone, and that's what's going to also lead to pain. There's pain receptors in that bone, as well as it's going to cause for more bone to build up. As our articular cartilage breaks down, there's going to be more bone formation, and as well as breakdown. So there's less support within the joint.
Right. So that piece of cartilage, that's really kind of our cushioning there between bones. And without that, I mean, I could just imagine how painful that must be. It's basically bone rubbing on bone.
Yeah, it can get there. It definitely can.
Yeah. So as far as treatments for this, I know sometimes they can put a little artificial stuff in there to kind of mimic the cartilage.
Exactly. Yeah. So if you're having significant symptoms or significant loss of function and you haven't already followed up with your physician, I would definitely go ahead and do that. And they can talk about different treatment options for you, but they can definitely do some joint replacements, and you can speak to your orthopedic physician about that. And
how different is the knee physiologically from the hip we were just looking at? I'm assuming we can't inject something in there as easily as we can with the knees, or can we?
Well, as far as injections, techniques have come a long way. What I would say about the knee, it's a joint that's getting used all the time, but it's also kind of limited in mobility in comparison to the hip. The hip's similar to the shoulder, where you have, the 360 degrees of movement. So it's taking a constant pounding, but it's the range of motion that it works through are pretty much the same movements throughout the day or with walking.